We get asked all the time from clients of ours at Everything Senior Insurance, what is the true difference and breakdown between Medicare Advantage and Medicare Supplement options and overall costs? In this video, I'm going to break down the pros and the cons across both of these plan options. Hopefully, it provides you with some clarity on which option might end up being the best for you. My name is Christian Brindle. I'm the owner and the operator of Everything Senior Insurance, formerly known as Christian Brindle Insurance Services, and we specialize working with folks on their Medicare health plans of all different shapes and sizes. We have been doing this for 11 years now, and there is not a situation I feel confident in saying that we haven't seen. And we do offer Medicare supplement plans, Medicare Advantage plans in 45 states across the United States. And so if you need help with your Medicare health plan, make sure to watch to the end of this video and reach out to us. Our contact information can be found down in the description of this video. So let's get started on Medicare supplement plans versus Medicare Advantage plans and what the pros and the cons and maybe what some expectations could be in terms of your overall costs. I will start out by saying this might end up sounding a little bit cliche, but depending on your needs and your preferences, that really does determine whether a Medicare supplement plan or a Medicare Advantage plan is a better option for you. It also heavily depends on what area that you might be in, because plan availability varies on Medicare Advantage plans and prices vary pretty significantly on Medicare supplement plans based on your market, based on your state, based on your zip code. Okay, so nothing is a blanket statement. There is a place for everybody in both sides of the spectrum. Let's start with Medicare supplement plans. So the pros of Medicare supplement plans are fairly obvious. The way that they work is they act as a secondary to Medicare. Medicare is your primary, Medicare Parts A and B, and they provide you with medical coverage, black and white. They don't cover anything outside of medical coverage. This would mean hospital stays, surgeries, doctor's appointments, etc. And on those medical visits and medical coverage, they typically provide 80% of coverage and leave an unlimited 20% behind for you to pay. Medicare also has some limitations on what it covers. As I mentioned a second ago, it is black and white medical coverage, meaning it doesn't cover things like prescription drugs, dental, vision, hearing, etc. And so that is why there is a need to pair your Medicare with a separate type of plan that fills in the gaps and completes the coverage in a sense. That's where Medicare supplements come in. That's where Medicare Advantage plans come in. But with Medicare supplement plans, it acts as a secondary to Medicare. So Medicare is your primary. It pays 80% of your medical bills. The Medicare supplement, or Medigap, as some might call it, comes in as a secondary and pays the additional 20% that Medicare leaves over on the medical bills. The rules with the Medicare supplement plan are simple. If Medicare covers the service as a primary, meaning it's a medical charge, the supplement will cover it as a secondary. If Medicare pays, the supplement pays. If Medicare does not cover something, the supplement won't either. So since Medicare, as we established, doesn't cover prescription drugs, dental, vision, hearing, neither will your Medicare supplement. You have to pick up additional plans when you go this route for those items, additional dental, vision, and hearing plans, additional Part D standalone prescription drug plans. And these can come at an increased cost, a separate cost from just your Medicare supplement plan premium. Kaiser Family Foundation put out a study in 2024 that stated the average Medicare supplement premium for an annual basis was $2,604 per year, or working out to be $217 per month. This means that before you spend anything with your Medicare supplement plan, you're locked in for that. The pros of it are between Medicare and your supplement, you are double covered, and you typically have very little, if any, medical out-of-pocket depending on the plan that you select. Some plans have more out-of-pocket responsibility for the member than others. Other times with Medicare supplement plans, and people look at it as a positive, that you don't have a network of providers that you have to stay in network for. As long as the provider accepts Medicare, original Medicare, they will also take your supplement regardless who the insurance company is that you run it through. That works the same in all 50 states across state lines. So that is very important to know when it comes to Medicare supplement plans. So keep this in mind. No networks, huge availability. Nowadays, probably 97% of medical providers nationwide accept Original Medicare. Works the same across state lines and very close to full medical coverage. But it does come at an additional cost. The average premium of $217 a month or $2,604 that Kaiser Family Foundation discovered in 2024 is just for your Medicare supplement premium. You may have to pay an extra premium for your Part D prescription drug plan, and you most certainly will have to pay a separate premium for your dental, vision, and hearing plan. So when you factor those two things in, that cost is oftentimes greater. It might be closer to $3,000 a year in annual premium, depending on your area and depending on plan availability. Now, that being said, with Medicare supplement plans, that is obviously the first negative, the increased medical cost. Remember, Medicare Part B has a premium that's $185 per month in 2025, and that premium is separate from anything that we're talking about here with your Medicare supplement plan or drug plan. So it has an increased cost every month and on a yearly basis before you ever use it. The other thing that's negative about the Medicare supplement market is every single year you can expect that your Medicare supplement plan will raise your rates as you get older. Every single insurance company does this, every single plan does this, and across the nation, we have seen the vast majority of Medicare supplement plans have very high rate increases due to inflation, due to lasting impacts of COVID is what some of them point to. And it used to be that you could find in a lot of areas Medicare supplement plans that would only raise your rate 5, 6, 7, 8, 9%. But in many areas, you might be forced to look at what I call double-digit rate increases. We're seeing many plans go up 10, 15, 20, 25, maybe even 30% depending on the area. So the rate increases are vast. So why wouldn't you just change your plan if it becomes too expensive? That would be the logical thing to do, right? The other thing that's a negative about a Medicare supplement plan is, for the most part, you can only get on one without health questions when you first get onto Medicare or turn 65. They waive all health questions and it's a guaranteed acceptance period. But if you try to change from one to another later, unless you live in certain states that have different rules, there are some states that have what's known as a birthday rule or guaranteed acceptance. There's a few states like that. But for the most part, if you try to change from one Medicare supplement to another, you have health questions involved, and you have to be medically healthy enough and able to answer those questions in order to get accepted onto the new plan. Okay? So you might potentially, if you go the Medicare supplement route and you want to stay there, end up being stuck on your plan if medically your health does not hold up, and maybe you can't be accepted by any other plan. But you have a plan that is going up 15%, 20%, depending on the area, every single year, okay? So that is the cons of Medicare supplements. So to reiterate that, you have higher increased cost on the premium side. You have health questions that are required to change plans in most states. And in addition to that, you have multiple different plans that you have to pick up. It is a little confusing for the average person because you need your supplement plan, you need your prescription plan, and you need your dental, vision, and hearing plan. So you can't just get one plan like most types of insurance. You have to stay with that type of model when you go with the Medicare supplement plan. So it's more expensive, it keeps getting more expensive, and you might have difficulty changing down the road. For Medicare Advantage plans, they come at a much different type of style and setup than a Medicare supplement plan does. Medicare Advantage plans work like so. You still get Medicare, Parts A and Part B. That part doesn't change. You still pay your Medicare Part B premium of $185 per month. But instead of running your Medicare through the government, you run your Medicare through a private insurance company, and they administer your benefits for Medicare, meaning they take on all the responsibility of paying your claims, so Medicare no longer needs to. What this typically looks like is all the claims, all of your billing, everything runs through the insurance company. As you can imagine, with Medicare not needing to pay 80% of your medical bills anymore, this takes a large burden off of the shoulders of Medicare. In exchange, Medicare agrees to fund the insurance company every month to take care of you. The numbers on that vary, and the star ratings determine how much funding they get, but on average, it's typically a pretty good estimation to imagine that the Medicare Advantage plans get around $1,000 a month per beneficiary, sometimes more, depending on the area and the plan type. Now, Medicare Advantage plans work like your traditional insurance. They have everything combined into one plan. You have your medical, your prescriptions, your dental, vision, hearing, all put together into one plan. They have medical copays. So unlike the Medicare supplements where you have very little out of pocket, you have medical copays for each time that you use it. And every area is going to vary in terms of what those copays look like. Usually, the copays are fairly affordable and pretty low, but if you use it a lot, if you're a high utilizer of your plan, the copays can add up pretty significantly. Now, unlike original Medicare, if that's all somebody had that has an unlimited 20% out-of-pocket patient responsibility, Medicare Advantage plans do have what's known as a medical maximum out-of-pocket, and it can range quite a bit. In 2025, the highest a Medicare Advantage maximum out-of-pocket can be is $9,350. But that doesn't mean it's guaranteed to be that. There's some areas that have a $2,000, a $3,000, a $4,000 max out-of-pocket. It's going to depend on what's available in the area that you live. Some areas have a vast array of competitive Medicare Advantage plans with a slew of different options. Other areas might only have a couple of plans available, and it might result in weaker coverage and weaker benefits. So where you're located matters mightily in terms of what type of Medicare Advantage plans are available. Medicare Advantage plans also have networks of hospitals and doctors, and you have to stay within the network. The pros of a Medicare Advantage plan is because they get all this funding from the government to administer your benefits, it's very common that the vast majority of Medicare Advantage plans come at a $0 monthly premium. This is because they're getting this funding. So because of that, in that scenario, if you picked up, say, a $0 premium Medicare Advantage plan, you'd be paying your Medicare Part B premium of $185 per month. And in most cases, that would be all. Okay. Now, the other pro of a Medicare Advantage plan is it is convenient, it's easy to use, and it's more similar to the insurance you might be accustomed with understanding when you're under 65. Any type of work insurance plan, marketplace plan, or Affordable Care Act plan, you have one plan that provides you everything. Medical, prescriptions, dental, vision, hearing, it's all together. It's easy to use, it's very easy to understand, and it's convenient. The other thing that's positive with Medicare Advantage plans is it covers a vast array of additional items that Medicare does not cover. We already mentioned dental, vision, and hearing, prescription drug costs, but they also typically can provide over-the-counter item benefits like covering items like aspirin, ibuprofen, fish oil, Band-Aids, and providing an allowance you can use to order those items, in some cases even pick them up in the store. Some plans might also provide a gym membership benefit, acupuncture, and a bunch of other things that Medicare might not provide. Again, plan benefits will depend on the area that you live in. Some plans might have a benefit in one area, but it might not in another. So this is important to understand. Now, what's the negative of a Medicare Advantage plan? Well, you have the networks, as I mentioned. Sometimes those networks, depending on the plan, can be extremely large and give you lots of options in terms of where you can go. Other plans can have a very restrictive and small network where you don't have a lot of choices in terms of how many providers you can go to. Maybe you want to go to a specialist and you just don't have that many available to choose from. God forbid you have a doctor that you really like to see and it's just not in the plan's network. So that can be a negative at times. Medicare Advantage plans also go through changes each year, whereas Medicare supplement plans do not. So the benefits change year in and year out, and sometimes it can result in making you change your plan if your plan changes too much for the worse underneath your feet during an open enrollment period, which happens October 15th through December 7th. Now, the other negative with Medicare Advantage plans is since everything is running through the insurance company, you typically do have more approvals that are needed to get coverage approved. Now, most of this ends up falling on the responsibility of the provider that you're seeing, but sometimes the providers don't follow through and get these things done like they need to. the insurance company might ask for a prior authorization for a surgery. Some plans, not all, might ask for a referral from your primary care doctor to see a specialist. Other plans might come back and ask the provider for more information to determine if something's medically necessary. The provider oftentimes might not respond. This depends on the provider, but we see that all the time. Whereas Medicare in and of itself does not look at these things as closely, and claims typically don't have as many requirements to get approved. So you do have your pros and cons when it comes to Medicare Advantage plans and Medicare supplement plans. The costs on them are pretty different. The thing that I would always think about is your utilization, but also the area that you live in. If you'd like a custom look on the area that you live in to break down these average numbers that specify to you specifically where you live, give our office a call. Our number is 801-255-5340. Again, 801-255-5340. And one of our licensed, extremely well-versed and knowledgeable team members can take a look at your specific situation where you are and determine if it makes sense from there to go one direction or the other. People always ask me which one's better than the other, and like I said at the beginning of this video, it does depend on your situation, it depends on your health, and it depends on your area in terms of plan availability. Hope this helped you get an idea of a 10,000-foot view on the differences between Medicare Advantage, Medicare supplements. If you enjoyed this video and you found it educational, do us a favor, smash the like button for the YouTube algorithm. It's going to help more people just like you find this video who need to hear this information, and we will see you on the next one. Happy Medicaring, everybody.